Autism is a complex developmental disability that typically appears during the first 3 years of life and is the result of a neurological disorder that affects the normal functioning of the brain, impacting development in the areas of social interaction and communication skills. Autism is a spectrum disorder. This means that it affects each individual differently and at varying degrees of severity. Children and adults with autism show difficulties in both verbal and nonverbal communication skills, social interactions, and leisure or play activities. Autism is considered to be one of 5 disorders that fall under pervasive development disorders. Autism is the most common form of PDD. It is said to be affecting an estimated 1 in 100 births. This means that as many as 1.5 million Americans are believed to have some form of autism. Autism is rapidly growing at a rate of 10 to 17% each year. If it continues to increase at this rate, the Autism Society estimates that the prevalence of autism could reach 4 million Americans within the next decade. Cases of diagnosed autism spectrum disorders have increased dramatically, but it is not clear how much of this because of improved diagnosis and expanded classifications of autism versus an actual increase in the disorder. There is no medical test to check for autism. Autism can only be diagnosed through observation and education and psychological testing. The National Institute of Child Health and Human Development lists 5 behaviors that indicate further evaluation in children. Does not babble or coo by 12 months. Does not gesture by 12 months. Does not say single words by 16 months. Does not say 2-word phrases on his or her own by 24 months. Has any loss of language or social skill at any age. There is no known cause for autism. It is mainly believed to be a biological disorder. The best scientific evidence available to us today points towards a potential for various combinations of factors causing autism, multiple genetic components that may cause autism on their own or possibly when combined with exposure to as yet undetermined environmental factors. Autism affects brain functioning. This diagram displays the parts of the brain that are affected by autism. People with autism tend to have difficulties in their social and communication skills. Along with this, they also engage in repetitive behaviors. These behaviors can include stereotypy, a repetitive movement such as hand flapping, making sounds, head rolling, or body rocking. Compulsive behavior, intended and appears to follow rules such as arranging objects in stacks or lines. Sameness is resistance to change. For example, insisting that the furniture not be moved or refusing to be interrupted. Ritualistic behavior involves an unvarying pattern of daily activities such as an unchanging menu or a dressing ritual. This is closely associated with sameness, and an independent validation has suggested combining the 2 factors. Restricted behavior is limited in focus, interest, or activity, such as preoccupation with a single television program, toy, or game. Self-injury includes movement that injure or can injure the person, such as eye poking, skin picking, hand biting, and head banging. In addition, people with autism can also have sensory abnormalities. This means that they are sensitive to certain textures or sounds. Asperger's syndrome is on the higher functioning end of the autism spectrum. Children with Asperger's are typically only mildly affected and frequently have good language and cognitive skills. To any person who isn't an expert on autism, a child with Asperger's seems to be just like a normal child that behaves a little differently. A child with Asperger's may be socially awkward. They may not have any understanding of conventional social rules, or they may show lack of empathy. They may make limited eye contact, seem to be unengaged in a conversation. Children with Asperger's typically have good language skills. Speech patterns in people with Asperger's may be unusual, lack inflection, it may be formal or too loud or high-pitched. Children with Asperger's may not understand things, such as irony and humor, or they may not know how to allow other people to engage in a conversation. Children with Asperger's tend to have a strong interest in a specific topic. For example, the child could have an interest in dogs. Because of their interest, the child will learn everything there is to know about dogs. They tend to become more knowledgeable about the topic than any adult in that field. 1% of the population of children in the U.S. ages 3 to 17 have an autism spectrum disorder. 1 to 1.5 million Americans live with an autism spectrum disorder. Fastest growing developmental disability, 1,148% growth rate. Cost of lifelong care can be reduced by 2/3 with early diagnosis and intervention. The cost of autism over the lifespan is $3.2 million per person.